Well, I'm joined here in the studio by Dr. Fozia Alvia, who's a humanitarian and medical doctor. She's been to the Rohingya refugee camps in Bangladesh to provide medical assistance. Thank you so much for coming in and helping us understand this issue. We've just seen the UN point fingers at Myanmar time and again as well for being responsible for this crisis. But I want to get your thoughts on the international response on the ground. Has the international community done enough to help people there?
First of all, thank you for inviting me here. I'm glad to be here. It's my pleasure to speak on the Turkish channel. So I went to Rohingya camps last year, and the conditions on the ground really blew my mind. I thought that we are hearing so much about this Rohingya crisis for the last couple of months. Last year, August 2017, the mass exodus happened. And I went there in October, and the conditions on the ground really blew my mind. So, and since then, when it's almost a year now, there's a lots of talks going on, between the UN, EU, International Criminal Court. World leaders are talking about it. But to me, nobody has taken practical steps to stop it. So I'm a medical doctor, not a political expert. But whenever I talk about UN and world leaders, I get somewhat critical on it because I don't think so. UN has a clear mandate to stop this genocide. It's been going on. There's about 300,000 Rohingya stick back in Myanmar, and they are starving to death, and nobody is helping them. So I don't think so. International community is doing enough to stop it.
What about the people living in the refugee camps inside Bangladesh? Are they getting the aid and the assistance from the international community that they need to rebuild their lives there? Because they're not ready to return anytime soon. Many of them still feel it's too dangerous.
You know, the conditions on the ground here in those refugee camps, they're literally garbage conditions. They're barely getting just the food, simple plain rice, and that's it. So international communities, lots of NGOs are there. They are barely keeping them alive. So those conditions are it's not a sustainable solution for them. And the land they have been assigned in Bangladesh is not a great land because it's the direct hit of cyclone, flooding. Last week, there was about 300 millimeters of rain in one day. So the conditions are not sustainable for them. So their life is not good at all. And due to the flooding, all those temporary toilets, they have been swept away. There's no clear water to drink. So infectious diseases on the rise, infectious diarrhea, cholera, waterborne illnesses, mosquito-borne illnesses, so they are on the rise. So I'm on the way to Bangladesh now, and maybe after coming back, I will give you the updates on it.
Are those the reports now that waterborne diseases like cholera have returned now to the camps?
Yeah, that's right. So when I went last year, and now I'm in touch with those doctors there, the lots of diseases that I just heard about it and I read in the textbooks because we don't see in our world now because due to the effective vaccines. But these Rohingyas, they did not have any access to medical health. So those are suffering all sorts of diseases like polio, cholera, all of these diseases, they are on the rise there. They did not have any access to medical care there. And here, there's about 1 million people sitting there. So it's hard for those small NGOs like doctors like myself, MSF, there's a camp for MSFs, lots of volunteers there. But it's hard to keep up when there is no clean water to drink. So we give them antibiotics to treat their diarrhea, and they come back right after 1 week.
It's such a huge task ahead, and your work really is commendable. Thank you so much for coming in, Dr. Fozia Alvia, and explaining the crisis to us and how more help needs to be going to these people in Bangladesh. Thank you.
You're welcome.